improved. Is there anything else that could be done to improve the availability of test and trace data, for example, to help inform decisions about local restrictions and further regulations?
Thank you very much, Monica, for that question. I was hoping that I could raise with the committee some of the ways that we could improve the transparency and availability of some of the data. The first thing I would say is that the dashboard that Public Health Scotland produces is excellent, and I know how hard all the analytical teams have been working at scale. And you know, we have some fantastic researchers and experts working on that, not just in Public Health Scotland, but the boards, etc. So they are to be commended for the efforts. It's improved hugely. It's very valuable for researchers and others. However, there are gaps. So the first one that you point to is, I think, that reporting the data by local authority in the same way as by NHS board is needed. You can actually drill down into that if you go through all the tables. It's possible to figure it out. But I think just providing it up front would be very useful to particularly local authority partners. So let's do that. I don't think it's a difficult thing to do. The second thing is that I would like to see, and this is probably a longer term ask, age-specific and sex-specific data more transparently provided for both the cases, hospitalizations, and as you know, Monica, there is currently an issue around how we define people in hospital, which I understand will be resolved, ICU admissions, etc. So age and sex specific data more readily available, though again you can get it if you look for it, because it's clear all the way through this pandemic that there's differences by sex or differences by age, and there are also, as we saw in Public Health Scotland's useful report, differences by ethnic minority communities, etc. So more of that, more readily available would be very useful, and that would be for tests, cases, hospitalizations and deaths. So all age combined data isn't sufficient. And the other thing that would be useful, as you say, is in terms of test and protect, as I've asked for in the past, what we're getting now is better than it was, but I would still like to have publicly available data on the time it takes for people to be contacted, and then to know, not just the proportion of contacts that are reached, and then to know what happens with those contacts. Obviously, they're all advised to self-isolate, but are people following that guidance, even if it's a sample that we see data from? What is the adherence, the understanding, and the compliance? Is it working, in other words? And then the final thing on test and protect is, in the testing symptom system, we're testing symptomatic and asymptomatic people. Most people get tested are symptomatic, that's the public, because they're coming forward for tests. But you have a lot of other people who are now being more routinely tested, care home workers, NHS staff, etc., who are just being routinely tested, so they're not symptomatic. So that's the asymptomatic group. I'd really like to see a clear breakdown of those two groups, because they're quite different populations, and it will give us a sense on the symptom side, particularly, how many people are experiencing symptoms, etc., why they're coming forward for tests.